We just spent 10 minutes restoring mobility through the pelvis. And we had you get up and walk, and you wore a smile on your face.
Yes, I'm very
You're still
excited.
smiling?
Yeah.
How do you feel?
I feel much looser already. I can tell immediately when I stand up that it just feels better.
Good, good.
Yeah.
Let's have you lie on your stomach. And I'll let you roll over. Very good. Legs out straight. So we used a passive force on a fulcrum for 10 minutes. And for 5 of those minutes, I also added pressure on the sacrum. And now I can load the pelvis, I can spring it, and it recoils. And now that I'm finished doing that test, I can let go, and there's another recoil. So there is certainly improved mobility of more force transmission going through the pelvis. Lie on your stomach, please. Sacrum is deep to my thumb now. This thumb is on the PSIS. I'm on the sacrum now, and I'm loading it, and I'm springing it. I can thrust it forward, it recoils. And I'm going to do an inferior spring through the ilium. I can see your heels bobbing up and down. So yes, there is improved mobility through the pelvis.
Yeah.
So let's have you lie on your back, and we'll look at your upper cervical spine. I can see your feet bob up and down. I can easily move that. I can easily lift your head up. I can spring your mastoid. And C1 I can glide over very freely. So this pattern up high in the upper cervical spine released reflexively. I didn't touch this area.
Yeah.
Didn't have to. When you free up the pelvis, and the same can be said of the ankle joint and the subtalar joint, that the upper cervical can oftentimes reflexively release. So I'm going to stop filming now. And so this is an example of a whole body approach of looking at the pelvis. And you came in with a primary diagnosis of sacroiliac joint dysfunction. We found a very rigid pelvis, but also found problems with your ankles and the joint below the ankle called the subtalar joint, and then a reflex phenomenon up high in the cervical spine. Certainly have more work to do with your ankle, especially the left one. But this is day 1, and I think we're off to a good start. Thanks for letting us film you.
Thank you.